I really wish I could be there with you. It's much better to be in person together and to be able to, sort of journey together. And for me to also, I'm not totally sure what all you all are talking about, but I'm going to share the work of the Center for Faith and Community Health Transformation, which is an initiative here in Chicago. I think it will be a little different than some of the other things that you're going to be hearing about today. We don't have a big program where we're serving hundreds and hundreds of people. We really are a movement in Chicago in faith and health. And so I'll tell you a little bit about how this movement came to be and some of the ways that we try to work at the deepest root of faith and health, and just give you an example or two of how we're doing that. So just by way of background, the Center for Faith and Community Health Transformation is really a virtual center. It's not an actual place. It's mainly joint work between myself and others from Advocate Healthcare, which is a large faith-based healthcare system serving Northern Illinois. And we're just joining with another big healthcare system, so we'll also be in Wisconsin. But for now, anyway, we're affiliated with the Lutheran Church, the Evangelical Lutheran Church in America, and the United Church of Christ. And both of those denominational affiliations go back over 100 years to the beginning of the turn of the century, the 19th to the 20th century, and was founded by people of faith in congregations who looked around in their communities and saw health needs that needed to be addressed. And they, out of their commitment as people of faith, developed these small little hospitals, these small little clinics, these social service organizations that have grown and grown over the years to become Advocate, which is one of the largest providers of health care in the state. And so my role with Advocate is as the Director of Congregational Health Partnerships. I really see myself as continuing that legacy of relationship with congregations and faith-based entities, not only Lutheran and United Church of Christ, but across the whole spectrum of religious traditions. Our other partner is the Office for Community Engagement and Neighborhood Health Partnerships at the University of Illinois at Chicago. And that's an arm of the university that does community engagement, health education, particularly around nutrition, and a lot of kind of bringing research into the community and supporting community goals with research. So one of the things I want to say about the center is that it evolved very organically, and the work that we do continues to evolve organically. So yes, we do strategic planning. Yes, we think about goals and that kind of thing. But really, the work we do is very much rooted in relationships and comes out of relationships. So one of the kind of critical relationships that was foundational to our start was a project called Reach back in the day, 20, like a long time ago now, racial ethnic approaches to community health. And so through leadership at the Chicago Department of Public Health and the Neighborhoods Initiative at the University of Illinois at Chicago, which is now the Office of Community Engagement that I just mentioned, they had a big grant under Reach 2010, and they saw faith-based engagement as one of the key places where they wanted to work. And so, again, because of existing relationships, they invited Advocate Healthcare in as a partner to engage faith communities because we already were doing that work. And so through that partnership, we began to work more closely together, as well as with other partners such as the American Cancer Society, American Heart Association, Association, other organizations that were also interested in reaching into faith communities. So that's one sort of little relationship story that I wanted to share that is foundational to how we came to be. The other one is probably Gary Gunderson is there somewhere. Hi, Gary. We have to call Gary's name because his thinking and his work has really been instrumental in the development of our work. One of the key pieces of that was this interfaith health program that Gary led for many years, and the Institute for Public Health and Faith Collaboration, which was a way to bring, CDC-funded way to bring together public health and faith partners to think about how do we work together more effectively at the root causes of health disparities in ways that will create transformation in our communities and in ways that will really bring the strengths of public health and the strengths of together. And that event, that institute that a team from Chicago, pictured there, participated in, was foundational, I would say, in some of the development of the thinking, development of some key relationships, and some key commitments that came out of that institute that went on to become the second. Also through the Chicago Department of Public Health, again, because of existing relationships and presence by key people on a partnership for Healthy Chicago table, which was a multi-sector table of people that were helping the Chicago Department of Public Health with their community health needs assessment and their community health kind of strategy implementation plan. This idea for Center for Faith and Community Health Transformation was actually written into the plan for what we call in Illinois the I plan. The health department has to create a plan every 5 years around community health needs and how we're going to address those needs. So this idea for a center was written into that plan as a way of being able to reach into communities that were priority communities. So again, that was almost a spontaneous thing that happened where the leader of that partnership said, you know what, I've heard you talking, Kirsten, about this idea. Let's include this idea in the I plan. And so that in ways really gelled the work of this center and made it formal and gave it a plan to get started. So I share this history, and there's one more piece I guess I share too. In Chicago, our faith and health movement, and I talk about it as a movement because it very much is not just individuals, organizations sort of working on their own, but we found a way early on to really come together and bring our work together, align it, merge it, leverage it. And so at one point we had a faith and health consortium, which was a group of people working together on various projects and conferences. And then we also had the center developing as a key strategy for addressing health equity, promoting health equity, and addressing the social determinants of health. And so, you know, we went through a very careful process to think about how these two entities, these two movements would come together, and eventually came up with a model where the consortium became sort of a membership for the center and an accountability group for the work of the center. So again, I think part of what is important to me to share today is that we do approach this work in a different kind of way than many of the other programs that you might hear about today and amazing things that are happening in faith health collaboration around the country. We are, again, a very organic system in the way that we operate. And we have, I would say, 4 main ways that we move work forward. One is that we are an engine for visioning within the field of health equity and justice. Our center and the people who are affiliated with our center do a lot of thinking about what is it that faith brings that's different. What is it that faith brings that will take us farther, that will take us to these root causes, that will help us really address these things in a deeper way. And so some of the language that we use is very intentionally faith-based, and we try to kind of keep it open to a variety of things people from a variety of religious backgrounds can relate to. So we use language with moral imagination. You know, when we're facing an issue such as food insecurity in our communities, what is the moral imagination that we bring as people of faith to this issue? And how does that inform then what we want to try to do and what we want to try to accomplish? And each of these has a whole field of literature and all kinds of things that you could dive into. I'll keep it short for now. The other thing that we talk a lot about is this idea of spirit power. This comes from someone who is one of our founding driving forces within our movement, Reverend Jim Ben. He came up as an organizer in the Saul Alinsky model of organizing, which points to two main sources of power. One is people power, and one is money power. The Alinsky model also talks about winnable battles, that we really should focus on sort of what we know we can accomplish, what we know we can achieve. And Jim started talking about this idea of spirit power, that in addition to money and people, we also need spirit. We also need a conviction that we have within us through our religious teachings, our religious experience, our spiritual practices, the power to hope for things that we can't imagine now, things that seem impossible, and that indeed every movement toward social justice, toward equality, toward equity, has been driven in part by some element of spirit power, coming either from a faith perspective, and sometimes it comes from outside of faith as well. And the last thing that we include in our vision is this idea of love. We talk about love as a force for social change. Sometimes we have to use the scientific language of cohesion, social capital, social connection, and some of those indicators that go along with that. But at the heart of it, when we talk to people of faith in the community, they understand this language of love, and they're practicing this kind of love. And so part of what we're trying to experiment with and do is to figure out how do we work with this on the ground. And I'll tell you about a little bit later that we're working on. The other thing that we do is we do a lot of convening. So there's not one project that we are working on where it's just us. We are constantly identifying or having identified for us what is an issue that needs to be addressed, and then we play a role in convening a broad group of stakeholders around that issue. Some examples, and I'll talk about these in a little bit more detail later on. Trauma, adverse childhood experiences, as well as resilience and strength and vitality within communities is a topic that people have a lot of energy around. So we've had a lot of success in convening and moving forward work around that particular topic area. Mental health is another issue where we're really gaining ground in developing resources around anti-stigma and support services for people in community, in congregations. Research, faith and public health research is another place where we've, along with another entity, convened a faith-based community-engaged research network to really begin to support and highlight and help connect some of the research that's going on around faith and public health. We also use this language of hosting. So in our convening, we are not driving what is happening, but we are hosting our partners and our colleagues in a process of identifying what it is that we want to do and who has the bandwidth and the assets and the strengths and the resources to do what. For example, in our trauma and resilience network that I'll tell you about in a little while, one of the things that came out of our hosting model, our way of creating space for people to come together and bring what it is that they have to bring, resulted in the Chicago Department of Public Health, a big grant to work on violence prevention. And so they are actually leading and funding a lot of work that we're doing around supporting resilience in faith communities and supporting faith community leaders in promoting resilience and preventing trauma and healing trauma and adverse experiences. And then the last thing I would say is that we work really hard to actually practice what it is that we're visioning and convening for and hosting for, that we take a lot of intention about nurturing the quality of relationships that we have among ourselves. We believe that what we create is going to be influenced by the quality of the relationships that we have, the quality, our ability to manage conflict among ourselves, ability to share resources and see possibilities together. We also need time in our meetings and in our gatherings to not just rush through the agenda, but actually nurture our relationships with each other. And that has been the source of a lot of creative work that's come out of people just getting to know each other and being able to see opportunities to be connected. So I know I don't have a lot of time left, so I just wanted to talk a little bit about our Trauma-Informed Congregations Network. This is work that has really just been happening in the last year, since we had a summit in January of 2015. And the summit arose because a lot of people were starting to talk about trauma and resilience and faith and how we wanted to deal with that. Again, we convened and hosted an event to bring people together, not just to have a one-off conference, but to actually think about what is the work we try to do together. So out of that, the evaluation and the process that came out of that summit, there were 4 things that people said, we want more of this. We want to do more together. The first one was people wanted to know who's doing what already exists, so that we can find each other and we can network with each other. And so we have had an intern this year who created a survey, and we're just starting to get results back from that survey about in faith-based settings, what kinds of activities or programs, formal or informal, are happening that support resilience and address trauma. Another thing that people said they wanted was a common curriculum that could be used across all of our different religious traditions that would address, that would use theological language and spiritual practice and faith perspective to think about and prepare people in congregations to address trauma and resilience. And so we were really fortunate to find this existing curriculum. We thought for a while we'd have to create our own, but we found a really wonderful curriculum called Risking Connection in Faith Communities. And over the last number of months, we have been in conversation with the authors and the owners of that curriculum, and are now in a process where we are preparing 15 facilitators to be able to teach that curriculum. But again, we were very strategic in how we identified people who wanted to be facilitators for this. So not anyone. We wanted people that were kind of point people for their own networks. Our idea is that eventually we'd really like to saturate our faith-based environment with the model that is taught through this curriculum. So this is not an exhaustive list, but among our group, we have someone who does all the programming for the Presbytery of Chicago. We have someone who works with the United Methodist Organization that has outreached all of the faith community leaders, the pastors, in the Northern Illinois Conference for the United Methodist Church. We have 2 rabbis that are working with us that through the Chicago Board of Rabbis can reach Jewish congregations. Both of the major children's hospitals in the city or in the region are at the table at Healthcare's Children's Hospital, as well as Lurie Children's Hospital, which is the other large children's hospital that actually has a center on resilience. And so they're part of our team and are going to be doing work both within their hospital setting with the staff, but also out in the community with the networks that they're part of. The Interfaith Mental Health Coalition is an interfaith coalition on mental health, and so they will also be having a representative who can begin to do teaching. And then the Urban Resilience Network, or the TURN Center, is another major group within Chicago that is primarily in the African American community, preparing ambassadors to work in the community around trauma and healing. They have a hotline preparing faith leaders and others, community leaders, to staff the hotline and provide care and resources. And so they have access to hundreds of congregations that they're working with, primarily in the African American community. 2 other areas that I'll just mention very quickly. One is we also have within our network, the Trauma and Resilience Network, folks that are working on restorative justice. And so one of the things that came out through our summit was people wanted to expand those restorative justice practices into faith communities more intentionally. So we have a whole group that is working on a strategy for how to bring restorative justice practices into congregations. And then finally, people wanted to build their own community of practice, really develop relationships with each other, learn together, network with each other, and renew our own spirits as well. So, for instance, next month, as our community practice meeting, we're going to be focusing on the reality that faith communities, in addition to being great places of healing and support, are also places that can wound and can be places of trauma for people. That abuse happens within faith communities, judgment, shaming, exclusion, theological ideas that demean people or that frighten people. And so we have to be honest about that aspect of it as well. So our next community practice meeting is going to be focused on this idea of sacred woundedness that happens within a congregation in the path to healing from them. We'll feature the author of this book, Sacred Wounds, Teresa Peachey. So let me pause there and see if there are questions. I can't see you all, so I'm sort of just looking at my screen here, which is a little funny, but I assume that there are good people out there, and I'd love to have conversation with you. Are there questions or comments?
Yeah, thank you so much. That was beautifully done. So very appreciative. And we do have about 10 minutes for questions and discussion. So Kamani has the mic, and please have at it.
And I have to say, it's a little, your sound on your end is a little bit fuzzy.
Okay.
So just speak clearly.
Okay, well, let's give it a try, and if you can't hear, we'll attempt to make it clear for you. So, Sanny.
Hi, Kirsten. This is Sandy Magnan, co-chair of the Roundtable. Thank you so much for giving us this overview. Can you tell us more about the common curriculum, that risking connection and faith communities? How you are purchasing it or using it or gaining access, and then how do you see it rolling out within the faith communities? What will that look like?
Great question. So the Risking Connection curriculum, it comes from the Sidran Institute, S-I-D-R-A-N. Sidran Institute provides curriculum and training for clinicians around trauma and resilience. And so Risking Connection is sort of their main curriculum they offer. But they've adapted it, and it's evidence-based. I'll also add that for their clinical version. They have adapted it, and it includes for use in faith communities, and it's very intentionally multi-faith. Although I'd say mainly Jewish, Muslim, Christian in orientation, but we have people from other religious traditions have participated in the workshop and have found it to be accessible as well. The thing that we liked about it is it's based on the idea of relationality as being at the heart of the healing process around trauma, which fits very much with our own orientation to love and social connectedness as sort of the driver for transformation and change in community. So we really liked that part of it. We liked that it was multi-faith. And we liked that it also focused on vicarious trauma. So paying attention to the trauma that's experienced by faith leaders or community leaders as they are supporters of folks who have been through a traumatic experience. And that it also really focuses on the strength of community to be a place of resilience. So it's not just individually focused, but really thinking about community as well. So we have been working with their master trainer, and we have been negotiating with the director of the Sidran Institute about how we are going to be able to use their product. And it's not all finally resolved yet, but we will probably have to pay some small amount per person that we train that will go in part to Sidran Sports. Plus, there's a book which you can, if you Google Risking Connection in Faith Community, you can find the book and you can order the book. And so they'll also get some funding through the book as we take this out. So I had mentioned the strategy about making sure we had people that were kind of I call them nodal people, N-O-D-A-L, like people that are sort of at the heart of their own network. And so each person that's been part of the teaching facilitator process is committed to providing at least 2 workshops per year, and they're 2-day workshops. So it's a significant time commitment on the part of these facilitators to teach 2 each year within their own network. So we have 15 people that are in the process of being trained, 2 per year. So and then we have also a waiting list of other people who would like to be trained as facilitators as well. So the work of the curriculum and the training, the workshops will all come under the umbrella of the Trauma Informed Congregations Network. It will be coordinated there. We're working tomorrow. We have a meeting about indicators and outcomes measurements. How we're going to actually determine if things are shifting as a result of using this curriculum. So all of that will be coordinated under the trauma-informed conversations network.
Great, thank you. We have time for one more question.
Thank you for your presentation. My name is Terry Allen. I'm from the Cuyahoga County Health Department in Greater Cleveland, and also a member of the Roundtable. I thought it was interesting you mentioned how the Center for Faith and Community Health Transformation was written into the I-Plan. And so I'm curious as to that formalization. You talked about it being important for the center. How that will, in your sense, how it will support sustainability and resources going forward, a whole range of resources from staffing, potentially funding, continued support from a wide array of participants. What has that meant, and would you advise that for other similar groups working in coordination with public health as an important strategy?
Yeah, I think I got most of your question. Again, it's a little bit hard to hear. Yeah, that formalization within the I-Plan enables the resources of time, basically, and it has actually also helped us leverage other kinds of relationships with other health departments. So, for instance, because we ended up with such a strong formal relationship with the Chicago Department of Public Health, we then also were able to work with the Cook County Department of Public Health, which is, in Chicago. Chicago is part of the Cook County, but there are two separate health departments because both geographies are so big and both have such large populations. So we've had a whole series of contracts with the Cook County Department of Public Health to carry out work related to emergency preparedness, related to healthy lifestyles, related to policy, systems, environmental change strategies to increase physical activity and increase food access in communities. It's also I have continued on as a representative on that table, that Partnership for Healthy Chicago table, and served as co-chair for really just up until last year. Again, enabling just a more kind of cohesive way of working with the health department. So we've been able to do some educational programs with some of the different units within the health department. We worked really closely. Reach 2010 had some other iterations down the road that we were kind of written to provide the health ministry development and other kinds of work with state communities to do that. So I think that for us, this alignment with public health has been really critical for sustainability, for gaining a track record, for gaining, for showing that we are accountable, we can be a partner, and so we've become sort of the place for public health to partner with. There's a faith-based project they want to work on.
Wonderful. Thank you so much. And I hope with the sound quality being what it is, you'll at least be able to hear our applause for the effort that you put in this morning. Thank you.